Hi, my name is Ndubuisi Okoroafor. I'm a doctoral degree student in the psychiatric nurse practitioner program with the University of South Alabama. I will be presenting my quality improvement project, which is titled Screening for Self-Harm Using the Self-Harm Inventory in Inpatient Settings. About 5% of Americans at one time in their lifetime have been engaged in self-harm. 76% of those have been diagnosed with psychiatric or mental health illnesses. Therefore, this quality improvement initiative educates nurses to use the National Institute of Health recommended self-harm inventory to screen and initiate individualized positive behavior support intervention. Self-harm poses a major challenge with the potential for fatalities and very costly litigations to the healthcare system. It could be a cry for help, presenting a maladaptive manifestation of inner distress or pain. There are various forms with which individuals can inflict harm to themselves, which includes but not limited to head banging, ingestion of objects, insertion of objects into body cavities, burning, intentional falls, intentional overdosing, prescription medication abuse, superficial body coating, and body parts dismembering. Screening for self-harm is a fundamental issue of safety care in psychiatric inpatient settings. Currently, there is little evidence of routine screening as compared to depression in hospitals and psychiatric places. This project is premised on the belief that early identification and prompt intervention will help mitigate incidents of self-harm in our psychiatric institutions. Self-harm continues to be on the rise even as routine screening remains elusive. The National Institute of Health recommends the self-harm inventory as a tool for screening self-harm in inpatient settings. Currently, there is no standard tool for screening self-harm in our hospitals as compared to routine depression, especially in our psychiatric facilities. The positive behavior support helps clinicians not only to deal with challenging behaviors, but also to answer the fundamental question as to why does he or she hurt themselves. The Department of Justice, which had an oversight over the Department of Behavioral Health in 2008, mandated the Department of Behavioral Health to incorporate the PBS as a treatment intervention for individuals with maladaptive and challenging behaviors. Specific objectives for this project will include to educate psychiatric nurses on the use of the National Institute of Health recommended self-harm inventory. In assessing all patients, interpret the self-harm inventory score, initiate intervention on at least 100% of those that scored high on the self-harm inventory within 8 to 10 weeks. To implement individualized positive behavior support intervention on at least 100% of the adult patients that scored high on the SHI over 8 to 10 week period. And finally, to reduce the incidence of self-harm by at least 30% after 8 weeks of PBS intervention. This project was carried out in a government-run lockup psychiatric hospital, which is located in the southeastern part of the city. The population comprises of adults that are aged 18 years and above, mainly African Americans, Hispanics, Caucasians, and others. The ethnicity is diverse, but majority of the individuals speak English language. The population includes inpatient committed forensic and civil patients. Combinant sampling method was used to recruit 22 participants who are mainly psychiatric nurses. Therefore, the inclusion criteria would be nurses that speak English language and are licensed to practice in the area, who are willing to give written consent to participate in the project. To participate in the PBS psychotherapy, the subjects must score at least 3 and above on the self-harm inventory and indicate willingness to participate in the therapy. Exclusion criteria will be inability to communicate in English language and or failure to participate in psychotherapy sessions. The main tool for this screening will be the self-harm inventory, which will be administered by the participants. The process that was deployed during this project was a pre-test conducted to evaluate participants' prior knowledge of the self-harm inventory. And this involves structured questionnaire that had 8 questions, which was aimed at establishing the knowledge of the self-harm inventory and also willingness of nurses or participants to deploy the tool after training. Thereafter, the preliminary result was analyzed using the SPSS. The DMP students spent 30 minutes with each participant to teach on how the self-harm inventory can be used. After a return demonstration, participants who were ready to deploy the tool used the tool to screen the subjects. In all, 22 subjects were screened using the self-harm inventory. Analysis was conducted with SPSS and Excel using descriptive statistics, cross tabulations, percentages, charts, and tables. Subjects that screened high on the SHI were referred for psychotherapy using the PBS for 8 weeks. After 8 weeks of PBS intervention, subjects were re-evaluated with the self-harm inventory and analysis carried out. Post and pre-intervention results were compared. This is a sample of the tool that was used, the self-harm inventory developed by Sanson. It contains 22 questions that required simple yes or no answers, establishing the prevalence of self-harm amongst the individuals. Another good part of it is that it allows the individuals to state if there's any other method they use to hurt themselves, which was not contained in the inventory. The scores can be analyzed to show that 0 means no risk, 1 to 2 means mild risk for self-harm, 3 to 4 moderate, 5 to 6 moderately severe, and 7 to 12 means severe. The objective is to capture those that are between moderate to severe and then refer them for. The results indicate that 73% of the subjects that were screened positive for self-harm. That means they scored 3 and above. Whereas 27% were at no risk or mild risk for self-harm. Amongst the methods for self-harm that was screened, indicates that majority of the subjects hit themselves and banged their head as methods of self-harm, which is closely followed by those that cut themselves on purpose, which is 44%. After the 8 weeks of psychotherapy, it was discovered that the percentage of those that hurt themselves came down to 14%, from 73 to 14%, which shows that there was a 59% reduction in self-harm when the PBS intervention was applied. Also, the study shows that the method of self-harm while an inpatient and going through psychotherapy reduced drastically for those that did overdose, and many of the indicators were 100% reduced, except for medication refusal and those that refused food. Those two rose because of the fundamental right of the patients to refuse medication and also to eat when they eat. Our discussion here shows that self-harm inventory screening tool was effective, and it identified those that are at risk for self-harm. 73% of the subjects scored 3 and above before the intervention, and after intervention with the PBS, only 14% screened positive, that is 3 and above. Overall, the self-harm was significantly reduced by 59% after psychotherapy. Early screening and prompt intervention can significantly reduce self-harm in inpatient settings. And then self-harm inventory can be administered in 5 minutes or less. So this project to nursing practice includes: 1. Self-harm screening and intervention helps provide patient-centered, trauma-informed, safe care. Reduction in self-harm incidents is a cost-effective venture for most organizations and the healthcare system. Organizational goals of trauma-informed care can be met when there is effective screening and implementation of psychotherapy. Behavior modification will lead to lasting recovery and successful community integration for patients. This quality improvement initiative meets the National Institute of Medicine aim of quality healthcare delivery. Recommendations. The focus of caregivers should be on early identification and prompt intervention. In psychiatric inpatient settings should screen all patients for self-harm, just as they screen for depression, regardless of the diagnosis. Behavior modifications that are personalized to the patients should be encouraged. Organizations should aim at trauma-informed care for all patients, and future projects should focus on motivations to self-harm. That is, those things that make people hurt themselves. If those motivations are identified, then the formulation of positive behavior support will be effective. In conclusion, early identification and intervention will reduce self-harm. Self-harm inventory is effective in inpatient settings. And finally, the PBS psychotherapy is also effective in behavior modifications. Thank you all for listening, and have a blessed day.